channel viewers. In today's video tutorial, we have covered in detail about the recent advances in the management of gastric cancer. Highlights of this video tutorial will be AJCC classification, anatomy, TNM staging, the lymph node station according to the Japanese classification, the extent of lymph node dissection as per the Japanese latest classification, lab versus open distal gastrectomy in early and advanced gastric cancer. Then we will discuss about perioperative chemotherapy and reconstruction option and Korean practice guidelines that we have covered in the last part of the video tutorial. Now we will discuss about proximal versus total gastrectomy in proximal third gastric cancer. That is another important question, and again it raises doubts in the mind of trainees and budding surgeons and medical students. If that the patient is having cancer in the proximal third stomach, in the cardia or in the body, so what should be the surgical approach, like total gastrectomy or proximal gastrectomy? So there is not much literature on this controversial issue, and this is an important study by Rosa et al. Published in Gastric Cancer in 2018, in which they study the total versus proximal gastrectomy for adenocarcinoma upper third of stomach. This was a propensity score matched analysis of a multi-center Western experience on behalf of the Italian research group for gastric cancer, that is GIRCG group. So in this study, there were 75 patients in the proximal gastrectomy group and 75 patients in the total gastrectomy group. They have compared the perioperative morbidity and mortality in each procedure. So they found that the mortality and morbidity were comparable, but the anastomotic leak, the reflex esophagitis and anastomotic stricture, they were more in case of proximal gastrectomy group, and they were statistically significant for reflex esophagitis and anastomotic stricture. So overall, the present consensus and literature is in favor of total gastrectomy for proximal third gastric cancer. However, we lack any strong evidence in favor of either. So treatment is mostly based upon personal experience and consensus guidelines.